Alright, so this is the online lecture on stress and coping. So what is stress? So we all have stress in our body, okay? Every day we're a little stressed. It's good stress. There could be bad stress. So it's any disturbance in your normal balanced state. So again, it's very unique per person. So my type of stress might be totally different than your stress. Now again, I just said that it could be good or it could be bad stress. So is it harmful or does it motivate you? And it all depends on how are you going to cope with that stress. So the categories of stress, so there's distress. So this is like threatening health, prevent any goal attainment. So financial worries, failing a test or class, fighting with a friend or a family member, that can cause a lot of stress. There's a similar biological response in the body with distress. Eustress, so this is protective, this is good stress. It actually motivates you. It's usually short term. So getting married, the planning a wedding, having a baby, starting a brand new job, it's good stress. It's exciting. So a lot of times people feel motivated during this time. Developmental, this could be, again, having that baby, okay, going to college. And as we age, that we're accepting that are aging in life, okay, that it's going to change. Situational, so completely random. So be specific when you're thinking of these. It could be like a illness that just occurred. It says hurricane and accident. So completely unpredictable. What about an MVA, motor vehicle accident? You don't know when you're going to get into a car accident unless you caused it, but you don't know. Timing, so you're just unable to meet all the demands. Maybe you're just doing too much. I'll tell you personally, I had like 4 jobs at one time. Was I working every job every day, every week? No, I wasn't. But just having those PRN jobs, just in case I wanted to pick up here or do this, it caused a lot of stress, even though I wasn't even working. It was just always in the back of my mind that, oh, I have 2, 3 other jobs. Okay, I need to make sure that like I meet the requirements. So having those multiple demands, that could be a big stress. Now, when I quit a bunch of them, now I only have 2, that, okay, whew, I can breathe. I felt like I can breathe. So, anticipatory, so such as the future. So you all have an exam on Tuesday. So this could be this type of stress. You're worried about this upcoming exam. What will be on the test? How will they do the questions? Am I studying the right materials? So that type of stress. Now you've got to figure out how are you going to attack that stress? How are you going to cope with it? Physiological, so diseases, mobility problems, so it could be substance abuse, a sedentary lifestyle, that could affect you. Psychological, so family arguments, any work pressure. So another thing is poverty, a lack of education is a good example. So now we got to talk about how are you going to cope? How are you going to adapt? So there's adaptive coping mechanisms. So healthy choices. Make sure you're still eating a good, clean diet, using a support group, exercising when you need to. Reduce any negative effects of stress. So you got to have that good nutrition, sleep, yoga. Avoid any maladaptive coping mechanisms, which we'll talk about. Maybe meditation, humor. If you need a little laugh, go see a comedy or go watch YouTube and watch a comedy. Change your own perception. And if you're spiritual or if your client is spiritual, refer the spiritual counselor. So now maladaptive. And we are all, maybe, okay, I'm guilty. I'm guilty that when I stress, sometimes I don't eat at all. Sometimes I eat a crap load. Sometimes I eat the whole fridge and then I look at the fridge and I go, oh my gosh, I have no food. I literally just ate the world. Or you just slammed a whole box of Cheerios in one day and you're like, holy crap, I just ate a whole box of Cheerios. So those are your unhealthy coping mechanisms, maladaptive. So you're just doing a temporary fix. Some patients use substance abuse, drinking, alcohol, okay, those alcohol use. Now, thinking of a nursing diagnosis, so I wrote one here, ineffective coping, but related to what? As evidenced by, what's your evidence that they're having ineffective coping? So again, ineffective coping, it's the inability to form a valid appraisal of the stressors. You're not able to cope. And so our clients, sometimes they have all these stressors and we don't know about them, but then we really got to try and help them and assist them that they can get through this. And that's when we teach them about the adaptive coping mechanisms. So some coping strategies on how to deal with it, it all depends on your situation. So you can alter, adapt, or avoid. So alter is the stressor. So again, when I had all those stressors, I had 4 different jobs, 3 PRNs, 1 full job, 1 full time, and I had to change jobs. So I altered my stress. I chose the jobs that I enjoyed the most that didn't give me the most stress. Okay, adapt to the stressors. So changing your thoughts about the situation, such as clinicals. If you are so stressed about clinicals and you think it's going to be a nightmare and you're just like, oh, I don't want to do the CNA, or what are we going to do? Okay, you have to adapt to that stressor. You have to start changing your thoughts about that situation. And it could be anything. And then avoid the stressors. So if you're in a really stressful environment, stressful relationship, end it. Okay? I'm not giving you like any advice right now, by the way, but that's just an example. So adaptation. So this allows for normal growth and development. This is effective responses to life's challenges. So you're able to adapt depending on the intensity of the stressor, the effectiveness of your coping skills, and your personal factors, your resilience. So are you able to recover quickly from those difficulties? Factors that influence adaptation. So personal perception of stressors. Is the understanding of the stressor realistic? How successful have previous adaptations attempts been? So when you're trying to adapt to that stressor, are those mechanisms working? And if they're not, you need to reevaluate it and change it. The overall health status. So the number of illnesses present, okay, it could affect the ability to actually adapt to these new stressors. So if someone has a chronic illness, they may not actually be able to adapt. Support system. Do they have a good support system? If you have a strong support, you are definitely able to adapt better. The resilience. Okay, so this definitely has factors on it. Age has a huge factor. Developmental level, life experiences. This all help kind of with your ability to be resilient. Now we'll talk about the physical responses to stressors. So this is called the GAS, the General Adaptation Syndrome. So this involves 3 different stages. Okay, it's a response to distress as well as eustress. So the first stage is the alarm reaction. So this is stimulating the sympathetic nervous system. So this is your fight or flight. Now, what's happening with your body when you are in that fight or flight? The way I like to think of it is I'm walking in the parking lot, right? I'm on the 2nd floor. It's 9 o'clock at night. I'm a female, okay? I'm walking all alone. Now suddenly I hear, what's starting to rise? My heart rate starts going up. My blood pressure starts going up. How about my glucose? My glucose starts rising. What else rises? Okay, I'm breathing a little faster. Okay, there's going to be an increased blood flow to my skeletal muscles because guess what? I want to book it. I'm going to be running. Okay, so that's the stimulation of the sympathetic nervous system. Everything goes up. But then you have to think about what goes down, what decreases. Okay, do you think I want to pee when someone's about to chase me or kidnap me? No, I'm actually going to have a decreased blood flow to my kidneys because that blood flow is going straight to my muscles, so I can actually book it. I have that extra energy to run. Okay, now how about my GI? Do you think I'm going to have to go to the bathroom? I'm going to have to go poop? Absolutely not. Now, maybe later, because I'm all stressed out, but your peristalsis decreases, you're retaining sodium in water, so you're not going to the bathroom right then and there. You have no desire. Your respiratory, your bronchial dilation, so there's more oxygen to your muscles, your brain, and your heart because you need it. You're in that fight or flight moment. Then you have your resistance. So your resistance is when all your hormone levels return to normal. So you're trying to maintain that homeostasis. And this is when you're using all those coping mechanisms. You're trying to stabilize, okay, your heart rate, your hormones, your blood pressure. Now, if that is successful, you go to adaptation. Okay, you're adapting to this stress and you're going to recover. Okay, you're going to go into recovery. Now, when you're in resistance and you're not maintaining homeostasis, okay, your blood pressure, your heart rate are not, they're not adapting, they're failing to adapt, you're going to go to exhaustion. Okay, your blood pressure starts going down, your heart rate goes up, your respiratory rate goes up. So you're trying to compensate, you are trying, okay, but you're not able to adapt. And you're starting to, so the alarm reaction, it keeps recurring or it continues. It hasn't stopped until all of your energy is depleted. So those vital signs, you're starting to decompensate. And now when you're starting to decompensate, the patient can't adapt anymore. And then it could result to death, any illnesses, and injury. So again, fight or flight for your alarm stage. So what happens with your body, your cardiovascular, so the vasoconstriction, your blood pressure rises, you need that vital organ perfusion because I want to book it. Your respiratory, your dilated bronchioles, so you have an increased oxygen. Your metabolic system, so you have that increased availability of glucose, so your liver converts glycogen to glucose, because so then you get all those endorphins, okay? You're running, you want to get up, and you're like, someone's going to snatch me. I need to book it because I'm in this fight or flight. Urinary system, so you're not going to want to pee. Your sodium and water, okay, are retaining. GI, so you're not going to want to poop. You have a decreased peristalsis. Your musculoskeletal, you're going to have an increased blood flow to your muscles, so your blood vessels they're dilating. So then you can have that kind of helps you kind of book it. Okay, you need more oxygen to your muscles. I just want you to think about this. So based on what you've already learned about the physical response to stress, why does the body react with sympathetic nervous system manifestations in the alarm phase of the general adaptation syndrome? This is something for you just to reflect on. Now think of a time when you were physically and emotionally at a high level of stress, okay? I mean, just walking in the parking lot for me is stressful because I'm always looking around. I'm always like, am I going to get kidnapped? Probably because I watch too much, like, not true TV, but just too many kidnapping shows probably and YouTube. But how is your response similar or different than what we just talked about? Okay, now think about how you might approach caring for your patient who's under a great deal of stress. They're very stressful. They just found out they have a brand new disease. How are you going to care for them? How does that change you learning about the gas? How does that change your approach to caring for them? Okay, so now we'll go into the resistance stage. Okay, we talked about this already, but I'm just going to go over it again. So the goal is to maintain homeostasis. That is the goal. So this involves you're using those coping mechanisms. Your body's trying to cope. Your body's trying to adapt. Okay, here they're trying to protect itself from the stressor. The vital signs should return back to their normal range. But if you fail to adapt, or you can't contain the stress, or you can't deal with it, you're going to go in that third stage. And what's that called? Exhaustion. Now keep in mind, if you're able to adapt, then you're going to go into recovery. But if you're not able to adapt, you're going to exhaustion. So exhaustion. All your adaptive mechanisms are ineffective. There's a decrease in blood pressure, your heart rate's up, your respirations are up, there's vasodilation. When there's vasodilation, that blood pressure goes down, the heart rate goes up. This usually ends in death or any diseases. Okay. Recovery, like we talked about, that's when you're in resistance, that you go and you win and you're actually successful with your adaptations. Your coping mechanisms worked. But if they didn't, you're going to exhaustion. Okay, so now we'll talk about the physical response to stressors. So there's the local adaptation syndrome. So this is the response to stress involving a specific body part, tissue, or organ. So again, short term, okay, to attempt to restore hemostasis. There's the reflex pain response or inflammatory response. So the inflammatory response has 4 parts to it. First, your vascular response. So there's an alteration, include vasodilation. Vasodilation is an increase in blood flow, and there's an increased vascular permeability. The next one is cellular response. So this is when the migration of the leukocytes, okay, we talked about this in infection control. And then the mast cells and the coagulation factors, okay, they go to the site of injury where it's inflamed. Now, with the inflammatory response, it's going to create exudate. Okay, remember what exudate is? Exudate is your drainage. So the fluid that filters from the circulatory system into the area of the inflammation or the lesion. Then you're going to healing. So these are the physical responses to a stressor in a specific body area. Psychological responses, okay, could include your feelings, your thoughts, your behaviors. That could be any anger, any ego defense mechanisms. That means you're rationalizing everything, your projection, your denial, anxiety and fear. Could be depression. Consequences of a failed adaptation, okay? The stress is just going to continue. It's just going to continue. It's not going to get better, but it could and it will get worse. It's a repeated central nervous system stimulation, okay? There's an elevation of certain hormones, results in long-term changes in the body system. So some long-term effects could include a decreased immune response, okay, because of the stress. Could lead to hypertension, stroke, diabetes, GI, okay, it could lead to constipation or diarrhea depending on the client. Muscle tension, okay, there could be some muscle tension. And then it could lead to memory issues too, because you're feeling so stressed, you're distracted, you can't focus on something. And that all comes with the hormones. There's elevation of hormones, okay, that's a huge factor. Okay, so somatoform disorders. So these are mental disorders that manifest as a physical disorder. So I'm just going to briefly go through these. So we have the malingering. Okay, this is a manufactured illness to escape a duty or any work. Then we're going to kind of go, I'm going to skip some things, but still read through them. So stress-induced psychological responses. It could be from a crisis. Could be from burnout. It could be from post-traumatic stress disorder, from PTSD. So when you're assessing your client, you're looking at stressors. Do they have any stressors at work? Are they feeling stress at work? Do they have stressors at home? Do they have stressors, like, really when you're asking them, like, what do you do for work? And then you're getting this verbal and nonverbal kind of off-putting answer, you have to investigate that. Are they stressed? Is that why they're having chest pain? Is that why their blood pressure is elevated? What are their risk factors? How's their response to the stress? What is their coping mechanism? and ask them, you're like, do you have a good support system at home? Like, who do you go to if you need to talk to someone? What do you do when you feel overwhelmed? Basic questions like that, because you're assessing how they deal with the stress. On some nursing diagnosis, so if it's a physical problem, self-care deficit, behavior, okay, powerlessness, cognitive, so knowledge deficit, if it's emotional, ineffective coping, interpersonal, so if they isolating themselves, social isolation, spiritual, so spiritual distress, those are all different nursing diagnoses, and the outcomes. So the outcome is to reduce the strength and the duration of the stressor. So if we go back to gas, when we're in the resistance, okay, we're trying to cope with it, we're trying to stabilize our vital signs. Are we using those good coping mechanisms? And are we able to relieve or remove the stresses, the responses to the stress? Because are we going to recovery or we're going to fail to adapt and go to exhaustion? Some health promotion activities so that we can do as interventions for our clients is promote adequate nutrition. Help the client establish a routine that includes regular exercise, just 30 minutes a day. That's it. Teach the client to get 7 to 8 hours of sleep per day. Ask them what they like to do for a hobby. If they like to draw or if they like to just read, encourage them to participate in those activities. Help them manage their time. So, like, sometimes when you guys meet with me, I go, so what's your plan for tonight? That's kind of me trying to help you prioritize your tasks, manage your time. And I go out and I ask you guys sometimes, it's like, okay, what are you doing tonight? What are you doing tomorrow? And what are you going to do the next day? Okay, so how long are you going to do that? It's just balancing your time, the responsibilities you have in your life, and trying to prioritize what's the most important. And you're going to help your clients do the same thing. So if they are recently diagnosed with diabetes, okay, and now they have to change their lifestyle completely because they were eating out all the time, drinking, smoking, all these maladaptive behaviors. And now you kind of like before their discharge, go over, okay, you're going to go home today. What is your plan when you go home? Okay, now they'll go, well, maybe I'll take a nap and then I'll get up and I'll go to the grocery store. Okay, so what do you like to eat? Ask them what they like to eat. And then be like, okay, so what would you like to have for dinner tonight? Okay, it just helps them jumpstart on what they need to plan and just to prioritize their tasks and to educate them because having that lifestyle change, even just for diabetes, is a huge stressor because now they're thinking, well, great, my grocery bill is going to go up because now I'm diabetic and I have to eat all these healthy foods. When if you're good and you are actually budgeting well, okay, you could honestly stay the same or save some money when you're actually planning out meals. So you can help your client understand this and then kind of do a plan for the next couple of days. Okay, because then they feel, okay, I don't feel lost when I'm going home now. Advise them to avoid any maladaptive behaviors and tell them why. Don't just talk at them, talk with them. Okay? Have a conversation with them about this. And this kind of ties in with the therapeutic communication. Okay? You want to make sure you are actively listening, giving education. Okay? You want to continue to talk to them about things. You don't want to just like, oh, you can't smoke, you can't drink, stop eating sweets, and stop doing that heroin. What does that even mean? Okay, they don't even know what you're talking about because you're just barking orders at them. You have to give them the reasons why. You have to educate them. Like I talked about the STD kid, you have to start teaching them right when you say hello and teach them the entire time until they get discharged. So holistic and multidimensional interventions. So think of specific interventions to help relieve stress, or if they have anger management, maybe meditation, biofeedback, Reiki, humor. If they are thinking they're stupid, okay, they're like, oh, I'm so stupid, that's why I got fired, or, oh, I'm so dumb, that's why I failed my test. No, 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 no. You have to look back at what happened, okay? And you have to change their perception of themselves. Okay, so again, change the perception of the stressor as well. Identify and use those support systems. Reduce the stress of hospitalization. So that is a big one. Try to reduce their stress of a hospitalization visit. A lot of times your clients are going to feel like they're a burden. They're like, oh, I'm so sorry you have to do that. Oh, I'm so sorry. No, why did I get into nursing? I got into nursing. I knew I was going to wipe some butts. I knew I was going to clean up C. diff. I knew I was going to have to take care of this sweet little old lady or this nasty old man or vice versa. I knew I was going to do that, but because I care, because that's what nursing is. Nursing is caring. And you have to just tell your clients that, be like, no, don't worry about it. Like, this is my job. This is what I love to do. I want to help you. And then they have that support from you. They have that support from you. If they are spiritual, you can ask them if they'd like to see the chaplain. Okay. If it's something more psychosocial or physiological, so such as they want to harm themselves, employ the crisis intervention. Okay, if their stress gets to a point, you need to intervene, or stress to a point where they want to hurt themselves or hurt others, you need to intervene ASAP. No one should ever feel that way. You should intervene and employ those crisis interventions and use the proper referrals. Okay, so the basis for safe, effective care is thinking, doing, and caring. When a patient experiences stress and anticipatory grief when learning of a new diagnosis of cancer, how might the nurse show caring? Think about it, okay? Think about how you might show that you are caring for this client with a new diagnosis of cancer. Just some more critical thinking stuff. So suppose you're a new grad working in the medical ICU, providing care to an older client with end-stage liver disease who is combative and confused. Discuss ways you would provide safe, effective care. So think about what are possible causes of a disorientation. I can tell you one, liver. He probably has a high ammonia level, AMMONIA, ammonia level. So doing, what measures would you take to ensure his safety from self-harm or falling? I would check on him constantly. Maybe I would have to give him a companion for someone to sit with him. Because what if he's just like, I don't want him to hurt himself or get up and fall. So caring. How would you help your patient to relax and feel secure in the ICU setting? So how would you do that? Even if it's not the ICU setting, how would you help your patient to relax and feel secure? Here's a question. Okay, so that is the end of this lecture. It's pretty quick, but go back into your ATI book, your basic nursing book, and the notes you took in class, and go over all that stuff. And okay, that's all. Make sure you guys are doing questions on the topics we talk about in class.